Good morning, everyone. Thank you for joining us. Let me begin first by thanking everyone who has only dreamt that we would get to a point in America where we would recognize the need to treat everyone's whole health, not just the physical health, not just getting your blood pressure taken, not just mending the broken arm, but mending the broken heart, mending the confused brain, the anxiety, the depression that often is not visible. We are taking steps that this country has never before tried to go towards, and that is to treating mental health on par with physical health. And let this be remembered as a year where we laid the gauntlet to everyone. We challenged everyone to join us to make sure we showed that. Certified community behavioral health clinics have only been around for a short amount of time, but they have absolutely made a mark. And I think there is nothing more fitting but to have the champions and perhaps the instigators, as Congressman John Lewis used to say, the folks who got most in trouble and got most in the way of making sure we got this done, Senator Debbie Stabenow and Senator Roy Blunt with us today. And I think it's only fitting that they get to talk about the success of really embedding within America what we consider essential health care for all Americans. 90% of Americans today are telling us that they believe the U.S. is experiencing a mental health crisis. 90%. There is nobody on this earth who doesn't know someone in America who isn't hurting. Today we're talking about providing to Americans 24/7 support for crisis care. That's something that's only been available to some in some places, but depending on your income and your zip code, you could be totally out of luck. That's going to start to change. We're creating as well a very healthy partnership with our brothers and sisters in law enforcement so that we can work together to address the needs of a community and the challenges that we all face. Not all of them are challenges requiring a law enforcement officer. Some of them are just in need of a helping hand, a caring face. Think of this as a year where we launched big. 988 is now on board. It's the 911 for those who are about to do something they should not do with their own life. 988 becomes a place where you get help. And if we do it right, when you call that 3-digit number, you will get the support you need. And you will get the support you need because we now will be establishing nationwide certified community behavioral health clinics throughout the country. That becomes the glue that really brings together this notion of providing whole health to Americans. We are connecting the dots to make sure we give everyone whole health care. And here's the best part. CCBHCs are here to stay. And we are making a major commitment of $300 million to make that possible. So to each and every one of our speakers, Senator Stabenow, to Senator Blunt, to Assistant Secretary Delphin Rittman, to Administrator Brooks LaShore, to nurse and head of a clinic that does CCBHC work for everyone, Jennifer Messick, who you'll hear from shortly, and to Sergeant Chad Matthews of the Montgomery County Police. Thank you for being part of this. Let me now ask Senator Stabenow to step forward.
Well, good morning. It's a wonderful day, and one I think that Senator Blunt and I have been working towards for about 10 years. And it's so great to be here. Mr. Secretary, thank you for your leadership in HHS, for CMS and SAMHSA. Our leaders across the board have really been extraordinary in this effort. And we thank you so much for the partnership that has gone on for the last number of years. And of course, it's wonderful to have folks on the front line doing the work, making a difference, saving people's lives. So thank you so much. We've been working on this about 10 years, but people who are mentally ill or have addiction-related challenges have been waiting a lifetime for this. Back in 1963, in fact, Senator Blunt and I went to the floor when we first introduced the Excellence in Mental Health and Addiction Treatment Act and spoke about President John F. Kennedy, 1963, the very last law, amazingly, that he ever signed before being shot was a law to strengthen and develop community mental health. To basically say we don't want at that time what were called asylums for people being housed without treatment, but just being put away. We're going to close those and we're going to provide community treatment. Well, half of that happened. The hospitals got closed, but the community work, the excellent quality efforts that people need in the community did not happen for 59 years, but it is now going to happen. It is now happening. We are finally going to treat healthcare above the neck the same as healthcare below the neck. Not through grants that stop and start, but through healthcare. In 2014, our Excellence in Mental Health and Addiction Treatment Act created what we now call Certified Community Behavioral Health Clinics. It's a big word, CCBHCs, with high quality standards, and this is important. We modeled it after the work that Senator Blunt and I have done supporting community health centers, where you have high quality standards and then you can get full funding for the work of the clinic through Medicaid. So we modeled it after that. We developed 10 demonstration states to try it out. We thought things would work, but we wanted to test it so that we now have something that is evidence-based, which is why when our colleagues came together under the Bipartisan Safer Communities Act and said, we want to do something on mental health, we want to do something in this arena, what should we do? And everybody started thinking of grant programs, and Roy and I went, whoa, wait, stop. We have an evidence-based program that has been operating in 10 states and is transforming what is happening. And that's what we need to do. And that's what we did. It's the largest expansion of Medicaid health services since the Affordable Care Act. It is really transformative. And the overall funding in the Bipartisan Safer Communities Act is the largest investment in mental health and addiction treatment ever. When you count the other services and schools, the hotline, everything else that is in there, is the largest investment in mental health and addiction-related services ever in our country. So I'm going to thank President Biden for making this part of his unity agenda to make this happen. Today we're announcing the beginning of that. How states get involved. They'll be giving an opportunity to get a planning grant to put together those high-quality standards and then build from there. Step by step, we are going to take this nationwide. Now, I will mention one other thing, and that is that Senator Blunt and I, also to show and to get support across the country for this concept through the appropriations process, where Senator Blunt is a key leader, we developed startup grants, essentially. Grants to go that without Medicaid funding, but we could demonstrate how the quality standards, how the 24/7 crisis services would make a difference. We now have those individual clinics in over 41 states, and here's what we know: changing people's lives already. And this is why we were able to convince colleagues to make this part of this important legislation that was passed. People who receive services at CCBHCs show a 72% reduction in hospitalization. 72%. 69% reduction in emergency room visits. 41% decrease in homelessness, and they spent 60% less time in jails. JFK said this in signing his legislation: "One true measure of a nation is its success in fulfilling the promise of a better life for each of its citizens. Let this be the measure of our nation." Today, we fulfill those words, that promise. And I want to introduce my partner, who I would not have been able to move forward on this every day for the last 10 years if it had not been for the partnership and commitment and dedication of Senator Roy Blunt.
Well, Senator Stabenow and I are both glad to be here. We're glad to see what we think is a significant step in the right direction. As she mentioned, after the tragedy at Uvalde, as is always the case, the first thing that almost everybody says is, well, the mental health system isn't working the way it should be. And we both, we immediately talked to each other, and then we started calling everybody who was working on putting a package together to explain that we did have a system that was working. And Secretary Becerra, thanks for your leadership in this and your friendship in the time we all three worked together in the Congress and working together here. Assistant Secretary Delphin Rittman is doing such a great job on this. Administrator Brooks LaSure, we've worked with on many other things, but now in your job at CMS, so critically important. Excellence in mental health, treating it like mental health like all other health, so critically important. Debbie mentioned we had 8 states initially, and then we quickly were able to add 2 more. But what we're focused on are facilities. It took me a long time, as Caitlin Wilson, who's here, who was my principal staffer on this in the office, would know, just to get the acronym right for Certified Community Behavioral Health Centers. I called it the Excellence Act for a long time until we finally got to where we were really using that in all of our discussions about what could happen here. Places where you could go 24 hours a day, 7 days a week, 365 days a year, that had the kind of staff that the law requires you to have, not only the complete availability, but also staff that's available to do what needs to be done. NIH, the National Institute of Health, for a long time has used a number that generally something like 1 in 5 adult Americans has a diagnosable and almost always treatable behavioral health issue. 20% of the adult population, my guess is, after the last few years of COVID and isolation and other things, that number is probably about the same for the total population. How do we deal with that in a better way than we'd been dealing with it? So we started those 10 states, and then we decided we could actually expand that to units that met all the criteria, the qualified criteria that could do what those states were doing, basically statewide, in often largely bigger communities. 300 communities now have CCBHCs in them. 40 states already, including the 10 pilot states, have some element of this program. They know it's working. They know that the finance structure based on the federally qualified health center structure works. It's not just for Medicaid patients, it's for everybody. The way those facilities work is if you've got insurance that covers you in those facilities, you can go there. If you're under a government program that covers you, you can go there. If you don't have any of those things, you can go there, and there's a very manageable sliding scale so that if this is a facility that's close to you and available to you, you can use that facility. Telehealth also works particularly well with behavioral health. You're more likely to be further away from your behavioral health provider than you are your other health provider. Making all of that come together in a way that keeps people in the community, that keeps people with their family, that keeps people at their job, all that critically possible. And here we are, as Senator Stabenow mentioned, 59 years ago this month, the bill was signed that these big facilities would be replaced with facilities that were in your community that we're going to meet your needs in a better way and allow all of those things to happen. We now have the possibility for 50 states, and we're going to talk about how that happens in a minute, for all 50 states to take this big step forward. Law enforcement for too long in the emergency room, law enforcement in the emergency room have really, for most of that 50 years after those big facilities got closed in the 70s, became the de facto mental health delivery system for the country. Nobody is well served by that. Law enforcement isn't well served by that. The emergency room is not well served by that. And certainly the people that need help in that crisis moment aren't well served by that. Brent McGinney's here from the Missouri Behavioral Health Council. They've kept really good records, not just of the mental health efforts going on, but also the difference it makes in people's other health. Senator Stabenow mentioned that hospitalizations were 72% lower. Those hospitalizations are often not lower because they would be in the hospital for mental health. They're lower because if your mental health is in a good place, you show up for your other appointments, you go to dialysis, you take your medicine, you eat better, sleep better, feel better about yourself, and you don't wind up in the hospital for the other health concerns that can put you in the hospital. There is a dramatic decline in what happens in people's overall health if you're dealing with their mental health. That's an awful big part of the 72% reduction in hospital visits. Aren't hospital visits that you would have made hospital stays for mental health, but hospital stays you would have made for your other health concerns that you weren't dealing with because your mental health concern wasn't being dealt with. 9 years ago, we were talking about that bill that had been signed 50 years earlier. Senator Stabenow and I both couldn't be more happy to be here to see us at this moment. We know this works. We know the difference it makes in people's lives and the communities they live in, and it's a great time. And certainly one of the people that will be incredibly important in making this work is Dr. Miriam Delphin-Rittman, who will be here to explain from her point of view the nuts and bolts of how this works, of how states can apply, how they can be in that 10-year effort where we're hoping at least 10 states every 2 years will join the 10 states that are already making this program work and know it works. And Dr. Delphin-Rittman, thank you for all you're doing to make this work.
Good morning, everyone, and thank you, Senator Blunt. You know, I have to say, it is just such a pleasure to be here with Secretary Becerra, with Senator Stabenow, Senator Blunt, Administrator Brooks LaSure from the Centers for Medicare and Medicaid Services, Jennifer and Sergeant Chard Matthews. Thank you, everyone, for joining us today. You know, Senator Blunt and Senator Stabenow, I want to thank you for your steadfast leadership and support and dedication to all Americans. So thank you for the work that you do every day. You are tremendous champions for this model of excellence in behavioral health care, and we heard about some of the impacts and outcomes of this model already. Administrator Brooks LaSure, I so appreciate our partnership in this work and look forward to our continued partnership as we move this work forward. I have to say, we are so pleased to announce that HHS, through SAMHSA, authorized by the Bipartisan Safer Community Act, is expanding for states the opportunity to submit applications for $15 million in planning grants to develop certified community behavioral health clinics. This underscores the Biden-Harris administration's commitment to strengthening mental health of all Americans. In early 2023, we'll review applications and then award 15 states $1 million apiece to begin their planning process. So really excited about this process. In the planning phase, what states will do is they will work towards federal standards for a CCBHC model. They'll also establish prospective payment systems for Medicaid reimbursable services. So again, the collaboration with and connection with CMS. And then they'll also prepare an application to be part of a 4-year demonstration. So wonderful opportunity for states. And so let me talk briefly about what this means. We know that CCBHCs are the kind of care that you would want your neighbor to receive, that you would want to receive yourself, that you would want a friend to receive, or a family member. This model of care works, and we've heard some of the patterns and trends already, and I'll share a little bit more. Data has shown us that within the first 6 months of receiving services within a CCBHC, within the first 6 months, we see decreased homelessness. We see decreased amount of time in correctional facilities. We see decreased amount of time spent in emergency rooms for behavioral health care. We see decreased inpatient hospitalizations as well. And we also see an increase in positive functioning for individuals that are struggling with behavioral health challenges. So this is a model that we know that is demonstrated to make a meaningful impact in people's lives. The model is innovative. It is transformative. It provides 24-hour care, or crisis care, 24 hours a day, 7 days a week. If an individual is in crisis, they can connect with crisis services. Equally important, though, the model helps and is available for anybody, regardless of their ability to pay or wherever they live. So the access is a real critical component of this model. With this expansion of eligibility and a recent increase in funds, in just a few short years, we've gone from 70 CCBHCs to now over 450 CCBHCs across the country. So that is a significant increase in access. A significant feat led by President Biden and members of Congress, specifically Senator Stabenow and Senator Blunt. And so, again, they were original sponsors of this opportunity. So I'd like to close with this. We are pleased that, again, the HHS and SAMHSA is offering this opportunities for states to participate in the CCBHC planning grant. But we want everyone, a piece that I want everyone to take away is this, that we want to bring every American and every community hope. We know hope is so important. Hope ignited by knowing that care is available, that it is accessible, and that it is culturally appropriate. And also hope affirmed by the knowledge that we are demonstrating a commitment to improving the behavioral health of the nation through this announcement. And so now it is my pleasure to introduce Administrator Chiquita Brooks-LaSure. And Chiquita, again, is the administrator of CMS, and she's going to talk about CMS's role in the CCBHC model. So, thank you.
Good morning, everyone. As you can see, we are just so thrilled to be here, and I would say it's so important for us as a department, us at CMS, to really make sure that people are getting care in the most appropriate setting. And what a step forward with the Certified Community Behavioral Health Clinic demonstrations to really make sure that people across this country are getting care where they need it. And so, as you have heard, we are deeply appreciative of both Senator Stabenow and Senator Blunt for their decade of working to make sure that today would be a reality, because as the Secretary mentioned, we know we're in the midst of a mental health crisis in our country, and we at HHS are really committed to doing what we can to make sure that we turn that around. I will just say at CMS, as you've heard, we are working closely with our SAMHSA colleagues on this program that really allows states to test new strategies to deliver and reimburse services in an outpatient setting. SAMHSA provides the planning grants and takes the leads on certain requirements. CMS is responsible for implementing the enhanced federal Medicaid reimbursement authorized for the services that are delivered by CCBHCs. This funding provides the ongoing investment in these behavioral health clinics and helps them continue to provide the broad range of services that they offer to communities. I want to mention that this is just part of what we are doing at CMS to ensure that people who have Medicaid, CHIP, Medicare, or Marketplace coverage get quality, affordable accessible behavioral health care. As the Secretary said, this is part of a big package of really making sure that people are getting the care they need. In Medicaid, we are working with our state partners to expand support for community-based mobile crisis intervention services. Thanks to the bipartisan Safe Communities Act, CMS is also working to provide additional support for school-based services for children covered by Medicaid. Providing essential health care in schools, including mental health services, can reach children and youth where they are and help them to ensure they get the care they need. That's why, as Senator Stabenow said, this is the largest investment in mental health and substance abuse assistance in really a generation because of some of these other provisions. In Medicare, we are working to expand access to needed substance use treatment, as well as supporting providers to work at the top of their scope of practice to ensure people get the care they need. For private insurance, we're working to prevent surprise medical bills, including behavioral services. These are just a few of the policy actions that we are focused on and working to implement on behalf of the over 150 million people who are now covered by our programs. We're so excited about the expansion of the Certified Community Behavioral Health Clinic demonstration, and now I look really forward to turning it over to two people who are indeed the actual people delivering care. And it's so important that we not lose sight of the people actually who are on the ground. And so it is my pleasure to turn it over first to Jennifer Messick, who is the clinical director of the Behavioral Health Urgent Care Center. Thank you.
Hello and good morning, everyone. I feel so honored to have been invited here today to speak about my favorite topic, mental health. Our behavioral health urgent care team consists of administrative assistants, peer support specialists, nurses, therapists, and psychiatric mental health nurse practitioners. We are skilled at building a quick rapport with our consumers, recognizing their holistic needs, displaying cultural competence, collaborating with our multidisciplinary treatment team members, and providing patient-centered treatment options. Our team has built professional relationships with several local entities. We receive referrals from the emergency room at Luminous Health in Annapolis, from the J. Kent McNew Family Medical Center, Anne Arundel County Crisis Response Team, Anne Arundel County Public Schools, primary care providers' offices, local therapists, residential crisis providers, Anne Arundel County Mental Health and Substance Use Disorder Courts, and most recently, it seems, word of mouth from our previous consumers has been a great source of referrals. Since December of 2021, the Arundel Lodge CCBHC has served 3,016 consumers. Our Behavioral Health Urgent Care Center, we have served 809 consumers. Those are 809 lives in crisis that we have touched. We see individuals with known behavioral health disorders. We see those who are seeking help for the first time. On their first visit, we assess and initiate treatment on a walk-in basis. We provide psychotropic medications and medication-assisted treatment. We also offer bridge services for consumers until they have begun ongoing treatment and support services. Our Behavioral Health Urgent Care Center provides consumers with a safe therapeutic space. It's what our team prefers to call our judgment-free zone. Consumer testimony, it seems, is the best way that I can explain how important it is to have a certified community behavioral health clinic in our community. Here is some of the feedback we have received. This is the first time that I have ever felt like anyone really listened to me. Thank you for giving me my life back. You gave me hope when I thought there was none left for me. You saved my life. You saved my life. Is there anything else that I could mention that would have a greater impact than that? Thank you. I'd like to introduce our final speaker. His name is Sergeant Chad Matthews. He is a 19-year veteran of the police department, and as the Crisis Response Support Section Supervisor, he manages a team of officers and licensed clinical social workers who provide essential training in crisis intervention to police officers in Montgomery County and allied agencies.
Good morning. As the supervisor for Montgomery County's Crisis Response Support Section, I continue to see an exponential increase in mental health-related calls for service. These calls, while increasing in frequency, are also increasing in acuity. Oftentimes, that call for service places law enforcement in the position to possibly be the first to evaluate and attempt to connect someone with mental health treatment. The available options for most police officers when encountering someone experiencing a mental health crisis is either a trip to the hospital or a jail cell. The problem for law enforcement is simple. How do we best help those experiencing a mental health or behavioral health crisis? We know the answer isn't criminalizing mental health, and we also know that emergency rooms are not equipped to handle someone in a mental health crisis. It is this gap that programs such as Cornerstone Montgomery and our local Department of Health and Human Services play such an important role. These two CCBHCs are vital to bridging the gap between a law enforcement encounter and treatment. As a law enforcement official, I can say that we welcome the opportunity to continue working with community partners to increase positive interactions with those experiencing mental health crisis. We want to help those living with mental illness and their families to continue to destigmatize mental health. It is through such collaborative efforts that we will achieve this goal. One case in particular highlights the positive outcomes achievable through collaboration. Recently, I became involved in a challenging situation not too far from where we stand today. The patient, a client of Cornerstone Montgomery, was living with somatic symptoms disorder, mental illness, a non-existent family or friends support system, and had several minor interactions with us in law enforcement. Coordinating with a licensed clinical social worker from the Cornerstone Montgomery group, a half a dozen public and private providers, and my team, we all set out to work together. The outcome was a resounding success as we connected the patient to services that helped them better manage their illness. This effective model of collaboration continues today. I strongly believe it is a great time to be a member of the law enforcement community as we continue to work side by side with our friends and partners in the mental health world. Thank you. And I will, sorry about that. Sorry. Kamara Jones? Yeah. Thank you.
All right, now the fun part, Q&A. A few roles, one question. Please stick to the topic at hand. We want to prioritize those questions. That's why we're here. And we'll call on you and give you a mic so you can introduce yourself and state your question. So let's start with Peter Sullivan from Axios. Peter, if you could raise your hand, we'll bring you a mic. Turn to your, it would be, yeah, there you go.
Hi, thanks. Peter Sullivan with Axios. I want to ask for the senators, maybe. Obviously we have this bill today. There's also an effort, bipartisan effort in the Finance Committee to do more on mental health. Do you see in the lame duck anything more on mental health happening, specifically around mental health parity, insurance coverage, which sometimes is kind of a controversial issue in Congress? Do you see any kind of room to do more there?
Yes, I do. And obviously, we start with today, which is making sure the quality services are in the community. But I'm also, as a member of the Finance Committee, leading a bipartisan work group with Senator Daines on workforce needs, because one of the things that everyone will say is that we don't have enough psychologists and social workers and counselors and psychiatrists and so on. And so the chairman and ranking member of Finance Committee, along with Senator Daines and I, put out a report of recommendations, and we have a package of bills now that I would love to see move in the lame duck. I mean, one of the things we're working on is how do we take the finance pieces, because this was originally part of the broad finance package that we pulled out to do in the legislation that was passing. And there's still more on telehealth. The workforce, I think, is a huge, huge piece of all this, as well as other reimbursement issues. So I think that we'll see, I'm hopeful we'll see something. I will say that when you talk about mental health parity being controversial, actually mental health parity is the law of the land. It was a bipartisan effort. We reaffirmed it in the Affordable Care Act. I authored that provision as a member of the Finance Committee. And it's frustrating to me to see that it would be viewed by some as controversial when it's actually the law, and insurance companies should be should not be providing different copays and premiums and lengths of treatment and so on. And so the real question is how do we make sure that that's happening. But hopefully more to come, and I know it's a leader in appropriations that Senator Blunt's hoping to continue good work there.
Well, what we've done, and I do hope we can complete our appropriations work this year, which will make a big difference in how quickly we move forward on all of these areas. What we've done in appropriations, I think over the last 5 years, adding those additional units that were not in the 10 original states, and they're getting about $1 billion a year is where that expansion has gone. We want to continue that. Also, we were talking even earlier today, Senator Stabenow and I, about the importance of connecting with the governors. Governors in the 40 states that may very well have a big unit. I think Texas, for instance, has 4 big units in their state. We think those will be the states that are most likely to step up first and say, we know this works, we see it's working in a community or a handful of communities in our state, and we're talking about ways we can reach out to the governors particularly. I think the state Medicaid directors, many of them are watching this conference today, but reaching out to the governors, reaching out to the brand new governors, and being sure they understand that this is one of the things that their state has a chance to be part of, and right now is the time to do your best to be one of those first 15 states that would apply to be in the initial 10 states. Again, let me repeat how we think that works, and it's largely to be sure that the amount of money that we're putting in this bill allowed all 40 states that weren't there to participate, and every 2 years we'd be adding up to 10 more states. And so the governors are going to be important in that, the state mental health, behavioral health directors, but also the state health directors, I think, need to hear that message that your other health care costs go down. I believe at the end of the day we're going to be able to show in our original 10 states you probably saved more money on the non-mental health side than you spent on the mental health side to achieve that savings where people are dealing with their other health in a different way because they're in a better place with their mental health.
Cheryl Stolberg, New York Times.
Thank you. This might be for the for the senators as well. One of the things we know is that as a result of the pandemic, children and adolescents, high schoolers, have really suffered. And I'm wondering, do these CCBHCs treat children? Are there any special programs devoted to improving mental health services for young people?
Yeah, Cheryl, the answer to that is yes, they do. And also there's some school-based opportunities in the same bill that has this expansion. One of the things that I think can be real impactful at school-based is, again, we're going to third time mention telehealth. This is a particularly good way to deal with people that you've already met one time, and you know you can have that quick reinforcement of what needs to happen. That can happen at schools. You don't have to necessarily have the mental health provider in the school to be providing significant mental health access at the school. And one of the things Senator Stabenow mentioned, the importance of having the kind of professional staff you need. With the previous lack of service and opportunity, this was an area where people would have liked to have gone into full-time behavioral health just weren't doing it at the levels that we clearly need. So having people ready for those jobs, pediatric mental health and juvenile mental health would be two of the big needs areas right now, largely because of COVID and school closures and isolation, and social media has made, I think, created a number of challenges for that population.
And just to add to that, I think it's close to 1/3 of those being served right now by CCBHCs are children and young people, which is very important. Also, we have school-based health clinics that much more robustly funded under the legislation we passed, but some are now being funded or being run by federally qualified health centers. There's more effort now where CCBHC could help run a health clinic or partner with the health center to actually run the clinic. I think there's more work on permanent funding. Again, what we've worked on is transformative in that it's not just grants, it's ongoing permanent funding under healthcare. I think there's more that can be done in the school-based area. Senator Capito and I have been authoring what we call Hallways to Health, and we've authorized school-based health centers, but I still believe there's more that could be done through Medicaid and the Children's Health Insurance Program to make that funding permanent, again, not dependent on grants. Are great, but the grant runs out. And so making it more a part of the permanent healthcare system, I think, is an area we could still do more in, which it will be a priority for me next year going into that. But CCBHCs are already treating children and also part of the solution right now where schools can reach out to them to operate their health center.
I'm going to turn it over to Jennifer in just a minute to add from the clinic perspective, but I wanted to again mention what both of the senators talked about. We, CMS, have recently put out guidance really making sure that people understand how they can get reimbursed from Medicaid in the school-based setting, and that is certainly a priority of the administration to make sure that schools are using Medicaid dollars where they can.
And I just wanted to mention, as I said earlier, we have a very good working relationship with Anne Arundel County Public Schools. 23% of the patients that we have served have been our youth, and the youngest of which was a preschooler. So just to give you a little more information on how we're serving the youth.
All right, Ian Lopez with Bloomberg Law.
So it says in your release that there are 40 states and DC are currently eligible to submit applications. Have any of those states expressed interest in doing so?
While folks are getting ready to answer that, I would just say I don't know about specifics yet. Today's, I think, the first day to actually be able to apply. I will tell you that Senator Blunt and I have heard from a number of colleagues who want their states and are very, very interested in moving forward in this. But I think today's the first official day, right?
Yeah, that's correct. So we'll be releasing the notice of funding opportunity today, and then certainly being available to answer any questions states have and working to get the word out. So that states are aware of what this opportunity is about and how it can lead to their being eligible to apply for a 4-year demonstration grant.
And also, 30 of those 40 states have some sort of unit in the state already, and we'd expect those groups to be encouraging others in the state to encourage the state to have a statewide opportunity.
Angie Gonzalez, Spectrum.
It's sort of a two-part question for the senators. Senator Blunt, I know CCBHCs also have this substance abuse component, and we're talking about mental health, but the two are sort of intertwined. In my speaking with Senator Hawley many times about the state of what's happening with substance abuse in Missouri, how does that sort of play into the need for services related to substance abuse? And for Senator Stabenow, Did you feel like the Bipartisan Safer Communities Act was an opportunity to expand what you guys already did with this 2014 legislation?
You know, we really got engaged at the appropriations level, and by the way, I didn't mention my whole staff earlier, but both of our staffs have worked really well together on this, and we had the advantage of having the appropriators staff from Labor and Health and Human Services and Education, some of whom are here today, do a great job with Laura Friedel leading that effort for us. But the whole idea of substance abuse, if you don't have a behavioral health problem before you get addicted, you do have one immediately when you do become addicted. And this is a place where I think the federally qualified health centers, who were generally leading the way on substance abuse, have really reached out to the community behavioral health centers in a partnership that appears to be working. You know, we turned to this issue about 6 years ago, and I thought we're making real headway on particularly opioid and substance abuse deaths until, again, COVID created a lot of new challenges where if you had a support system that was working, suddenly you were likely to be isolated from that support system. We saw 2019 and 20 may have both set records for substance abuse deaths in the country, and these things are very interrelated. Like I said, if you don't have a behavioral health problem before you have a substance abuse problem, you immediately have one afterwards.
Yes, and I will answer your question. I do want to thank all of our wonderful staff, my team led by Alex Graff, who's been living this, breathing this for years and years and years, but our whole team has been so wonderful. And let me say before, well, let me start with your question to me in terms of did we see this as an opportunity? Yes. It was, you know, it's challenging because whenever the issue comes up around gun violence, we're also very concerned. We want to destigmatize mental health. I mean, mental health is a healthcare issue, and Roy and I have talked about this a lot. We don't want to somehow say that someone who is bipolar or somebody who's schizophrenic is a danger to somebody else. I mean, they're more likely to be a victim of a crime than to be a perpetrator of a crime. However, we also know that when we look at somebody who is going in and shooting up 20 children in a school, I mean, obviously there are serious issues there. And so we've always kind of figured out how to balance that, because we want this to be a broader part of healthcare and encourage people to step forward. Just like if you have a chemical imbalance called diabetes and you take insulin, you do that and you go on with your life. Well, if you're bipolar, it's a chemical imbalance in the brain, and you should be able to take lithium or some other medications and get the help you need and go on with your life. And that's the goal long term. But given what was being talked about in the fact that we had colleagues that were saying we want to do something big and bold in mental health, we thought we have to take this moment. We have to take this moment and not and we had very well-meaning colleagues sort of wanting to make up new grant programs. That's what always happens in mental health. Let's try a new grant program. And so the whole purpose of this is to institutionalize, in the sense of funding, you know, and quality standards, so that we know what needs to be done, let's fund it, and let's fund it as healthcare. One other thing I would just say is the terms get used interchangeably, and it's always difficult because, I mean, really behavioral health is mental health and addiction, substance use, it's all of it is behavioral health. People don't always know what behavioral health is, so we say mental health. Or I say mental health and addiction services, just because we also know that addiction changes your brain patterns. It's another form of brain disease. That's what happens. And so it's all part of the same thing in terms of illnesses in the brain, as well as emotional issues and so on. So, but we absolutely decided this was the moment, and we had evidence-based data to show people that it worked, and we're grateful that all of our colleagues and the president and everyone joined us.
All right, we have time for about 2 more questions. Caroline Tucker, NBC, where are you? There we go.
Hi, this question is for the Secretary. This is actually just wondering if you could address for us in Spanish for some of our Telemundo stations this announcement and, as you had said, connecting the dots for communities on expanding these mental health services in other states.
Bueno, creo que todos sabemos ya que nuestro país, nuestro pueblo está sufriendo. COVID causó muchas cosas. También ha causado dolor mental y en este momento sabemos que el pueblo norteamericano busca ayuda. Se dice que en las encuestas que como 90% del pueblo norteamericano en este momento está diciendo que nuestro país está experimentando una crisis mental. Eso quiere decir que casi todos nosotros tenemos seres queridos que han sido afectados mentalmente, que están sufriendo. Este anuncio hoy, que es posible por todo el esfuerzo que hicieron por una década el senador Blunt y la senadora Stabenow, nos ha llegado al punto a poder decir que vamos a tratar el asunto de salud mental como se trata el salud físico y que vamos a darle la atención que merece y que vamos a entender que es algo que el pueblo quiere ver y necesita. Así que este es un anuncio muy importante porque de aquí avanzamos diciendo que cuando tratamos con la salud del pueblo, estamos hablando de toda la salud, incluyendo la salud mental y para los que necesitan servicios sobre la adicción. Y eso es algo sumamente importante en este momento de crisis.
Amanda Seitz, Associated Press. Where are you, Amanda? There we go.
Thank you. This question is probably for Dr. Delphine Rittman. I'm curious how these community behavioral health centers have been working with the 988 Center. One of the things that we've heard is that once that call is over, people do face long wait times to get the care that they need. Can you talk a little bit about how these grants will continue that care for those in need?
Yes, absolutely, and thank you for that question. I think it's such an important part of the full continuum. And so what we know is that, in fact, already many CCBHCs, because they offer crisis services, already are in tight partnership and ongoing communication with the 988 crisis call centers. And so what the CCBHCs offer is really an expansion of the community-based services to ultimately connect people to. You know, we've talked about ultimately the crisis continuum is about having a place to call, so that's the call center, but then also having a place for people to connect and a place for people to go. And so the CCBHCs absolutely help with that because they offer 24/7 crisis services. In some instances, they actually have crisis teams and mobile crisis teams themselves as well. And so there's definitely a tight collaboration and communication between the 988 call centers and then the CCBHC teams, particularly the crisis component of the CCBHCs.
And this will be our final question. Dorothy Mills-Gregg, Inside Health Policy. Where are you, Dorothy?
I didn't actually have a question, but thank you.
We can pass it to someone else if you don't.
Yes, I'll pass it to
Okay. What about ABC? We have ABC here, several. All right. Reuters? Jonathan from Reuters? Any more questions? If you have a question, raise your hand if you haven't asked one. So I don't think you've asked one in the blazer, and then we'll end with you.
Hi, this is Basil John with Nexstar. I just wanted to get a question for clarification. So I know that the money and the resources that are dedicated for these different clinics, it would go towards the resources necessary to help with mental health resources and also substance use. I just want to know if anybody could answer, will part of the funding also be dedicated towards security at some of these clinics? Just because even in average hospital settings, there are issues that do come up throughout the country of those who do have mental health problems where they do lash out against staff and other clinicians.
Well, you know, the way the the federally qualified health center model works, which is what we base this on, is they take all of their expenses and all of their various sources of income and have sort of a settlement at the end of the year. And if that federally qualified health center feels like that they need, or the certified behavioral health center, that they need a security, that would be one of the things they certainly would be able to put into that entire equation. And let me also add one other thing. Senator Stabenow made such a really good point about our concern about not suggesting that behavioral health is dangerous. You know, we need to get to where, as a society, you're just as willing to talk to your friends about somebody in your family who has a mental health problem as somebody who has another kind of health problem. You know, there's not very much hesitancy to talk about, you know, my mom or my dad or my children has cancer. We should get to where we can talk about mental health with the same ease, with an understanding that this is a health problem. It is almost always almost 100% of the time a problem that can be dealt with in a way that people continue to be able to be part of their family and part of their community. That was the goal 59 years ago. It is a goal we're much closer to today than we have ever been before, and a decade from now, hopefully, everybody will be within easy reach of a behavioral health, the kind of behavioral health, mental health that they need, just like they are, hopefully, in easy reach of the other kind of health care that they need.
You know, I would just make one final comment. I remember the days when we used to say, she has cancer. You know, you'd whisper, somebody has cancer. And now people openly talk about various cancers and the treatments that are going in, and colleagues talk. And so this really is what we're talking about, is someone being able to openly talk about an issue in the brain, disease in the brain, as well as any other part of the body. The final thing I would just say that relates sort of to your security question is that the model here is to fund the entire clinic. Right now, in our community mental health centers in Michigan or across the country, there's various grants, there's some funding. There's Medicaid funding for a person if it's a severe issue. So it's based on the person, not on the costs of the clinic. And so the difference is being able to provide, and we're providing enhanced Medicaid so that there'll be additional dollars to be able to fully fund the clinic, but then it's based on the full funding and the costs of the personnel, the costs of the clinic, so that you're not worried. It's not this patchwork approach of trying to figure out how do you keep services going. And that's why we call it transformative in the area of behavioral health.
That's a wrap. Thank you for coming.